Hello, my name is Leah Habib, and today I would like to tell you my story. Beginning the menstrual cycle should be a turning point in a female's life, as when you begin your menstrual cycle, you officially become a woman. I first got my period when I was 12 years old, which to begin with attracted medical attention. I got my period once every 6 months. The week prior to my period, I would be extremely nauseous, vomiting almost every day. The doctors always told me that my body would adjust and work itself out, and my menstrual cycle would soon become regular. My weight often fluctuated, differing on an average of about 25 pounds each year. Then one day, I noticed hirsutism occurring on my face. At age 16, I took things into my own hands. I went to check my hormone levels, have an ultrasound of my ovaries, and consult with a gynecologist. The ultrasound revealed that there are several cysts on my ovaries. This combined with my blood work was enough for me to be diagnosed with polycystic ovary syndrome. Polycystic ovary syndrome is a disease that affects between 4 to 12% of women worldwide. This statistic includes both Bridget and myself. Some of the women we see eating here today most likely have PCOS and are undiagnosed because until recently there was no clinical definition for PCOS. After the 2003 Rotterdam PCOS Consensus Workshop, it was decided that at least 2 of the following criterion must be met for a diagnosis of PCOS: chronic anovulation, clinical and/or biochemical signs of hyperandrogenism, and polycystic ovaries on an ultrasound, according to a study done by Deepika et al. In 2011.
Some ethnicities are more susceptible to PCOS. For instance, in 2011, a study was done to examine the prevalence of PCOS in Iranian women. This study found that in a group of 929 women, 10.9 had hirsutism, 8.3 only had anovulation, and 8% had only polycystic ovaries. The study also produced interesting results regarding the definitions of polycystic ovarian syndrome. Based on the previous mentioned Rotterdam definition, 14.6 were found to have PCOS, but when using AES and NIH criteria, only 11.6% and 7.1% were diagnosed with PCOS. Thus, the study concluded that when using the Rotterdam criteria to diagnose PCOS, the prevalence of the disease does in fact increase. Clearer definitions and screening methods are needed to improve the comparability in public research. This was concluded by Tehrani et al. In 2011. As you can imagine, living with PCOS is far from easy and requires specific lifestyle choices. My sister, Tricia, has been living with it.
How long have you known you had PCOS?
I've known for about 7 years. I was 18 when I was diagnosed.
Okay. How were you diagnosed?
Well, when I first went away to college, it was a stressful time, and I didn't have my period for a while. And when it had gotten to 6 months, I started to get worried, and I didn't have to worry about pregnancy at the time, so I went to my gynecologist, and he told me what was going on after we had a couple of tests done, including blood work and an ultrasound. So he found out that my ovaries were bigger than they should have been.
Okay. How has PCOS affected your life?
It's affected my life in a lot of ways. Like many other women with PCOS, I have a greater propensity to be overweight. I've been going to a dietitian to help with that. Also, I have to follow a strict diet. I can't really eat any carbs or sugars, and I've been kind of having a hard time with that.
Okay. How long have you been seeing your dietitian?
For about 2 months. I should be exercising constantly too, but because I'm more susceptible to weight gain. It's kind of like having diabetes, and that anything that I eat that I shouldn't be, that ups my blood sugar, will go straight to fat.
When discussing with my sister regarding hirsutism, she noted that while it didn't affect her personally in her love life, that it has affected some of her friends. She has several friends who have hirsutism as well as PCOS, and that's how they were also diagnosed. She found that things like Nair help. I know that I personally do have some hirsutism, like just right over here and just in a few other places, and that's how I was diagnosed as well. Trisha is very lucky because many women with hirsutism are affected negatively when put into an intimate situation. Women have identified as feeling uncomfortable and insecure about their attractiveness and sexual compatibility. Even patients without hirsutism experience negative effects in their family life, professional activities, leisure activities, and physical fitness. I know personally through talking with other friends who have PCOS and as well as interviewing my sister and just discussing with her on a regular basis about our PCOS that we are scared that we may not be able to have children or conceive, or we'll have a difficult time and may potentially have to do IVF, in vitro fertilization, or something similar to that. So it's a really difficult situation for many women to be in, not only because of weight and potential for diseases, but also potential to not have a family that you wish you could have.
Although there have not been any studies to correlate anxiety, depression, and PCOS, research has been done to examine the relationship between PCOS and cardiovascular disease. Meyer et al. Concluded that there is, in fact, a correlation between PCOS and cardiovascular disease, particularly in women who are obese and have an increased level of insulin. This is simply due to how hormones interact in women who have PCOS.
When interviewing my sister, I mentioned to her that anxiety and depression, while not correlated specifically with PCOS, it's thought to potentially have some correlation. So she actually found this funny because all of her friends who have PCOS, as well as herself, have anxiety and depression, or one or the other. So she found this funny just simply because while it's not specifically associated, most people that she knows that, and also that I know, have tendencies towards those. One of the things that makes PCOS so complex is that the cause of the disease is still uncertain. It affects many women worldwide, and many people believe it is genetic, but there is no substantial evidence to support this claim. Others argue that healthy diet and lifestyle reduces the symptoms of PCOS, particularly helping with maintaining a healthy weight. When healthy weight is maintained, patients are less likely to develop other diseases such as diabetes and cardiovascular disease. If trying to conceive, treatment is available for the forms of oral contraceptions, in vitro fertilization, and ovarian wedge resection and ovarian drilling. If you feel you are at risk for PCOS, consult with your doctor.